Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about magnesium. Deficiencies in magnesium are common, probably secondary to only deficiencies in vitamin D. And when you become ill, especially chronically ill, the likelihood that you are low in magnesium increases many-fold. Today, we'll have a little quiz to help you understand and maybe suspect that you could be having a magnesium deficiency. Join us today and take that quiz. You'll have a better idea of how to correct your health condition after that quiz in our presentation today. That's the concept for today. It's magnesium, very important. First, let's go to our news. Let's see what's happening in the health world. Women who eat a healthy diet have less physical disability in their senior years. Researchers from Brigham and Women's Hospital evaluated over 54,000 women's diet and health over 28 years. They found those who ate healthy have fewer physical complaints and less disability with age. They found those who consistently included fruits and vegetables in their diet while avoiding sugar and high fructose sweetened beverages, trans fats, and sodium were better able to participate in the activities of daily living with age. Well, you know, this one just makes sense, doesn't it? Eat better foods, perform better physically with age. But surprisingly, there has been very little research that looks into the effect of diet on physical disability later in life until this large study conducted on over 54,000 women involved in the Nurses' Health Study. Now, overall, eating healthy in our youth leads to better mobility in our senior years. Once again, the stars of the healthy diet are fruits and vegetables. The foods to avoid are sweets, sugar and high fructose sweetened beverages, trans fats, and excessive salt. The study also found that eating certain foods helped women remain physically active. Those foods include oranges and orange juice, apples, pears, romaine and leaf lettuce in general, and of course, walnuts. The authors of this study noted the combined effect of a healthy diet was far more powerful than just adding orange juice to an unhealthy diet. But you know, for many of us, we start making dietary changes with small baby steps. So at least add these healthy foods right away to your diet. Driving a car for more than 1 hour a day adds pounds and inches to the waistline. Researchers from the Australian Catholic University evaluated health parameters and driving practices of 2,800 adults. They found the subjects that drove for more than 1 hour a day weighed 5 pounds heavier, and their waistline was 2/3 of an inch longer. They also found driving's obesity-promoting effect was most pronounced in men. Now, it's been estimated that some 86% of all Americans use cars as their primary form of transportation. And of these, some 45% are in their cars for an hour or more every day. That means 120 million Americans are heavier with an increased risk of cardiovascular disease simply because they spend so much time behind the wheel driving. The point of this is not to lock up your cars and throw away the key, but rather, if you spend a lot of time in your car, it would also be wise to develop some exercise options to negate the health and obesity risk excessive driving creates. I can't imagine a life without the convenience of a car, especially for those of us who live in the wide open spaces of the western United States. But these wide open spaces also provide us with tremendous outdoor exercise options. Eating a Mediterranean-style diet rich in healthy fats and oils does not promote weight gain. Researchers from the University of Barcelona evaluated the effect of 3 different diets over 7 years on almost 7,500 subjects who were all at heightened risk of cardiovascular disease, had diabetes, or were overweight. The 3 diet options were a calorie-unrestricted Mediterranean diet with olive oil, a calorie-unrestricted Mediterranean diet with nuts, or a low-fat diet where the participant was advised to avoid all dietary fat. They found the group that ate the Mediterranean diet with olive oil lost the most weight and saw the greatest reduction in cardiovascular disease risk. Well, this study is most telling, isn't it? Those who ate the Mediterranean diet, a diet with olive oil, lost the most weight and saw the greatest improvement in their overall health. Now remember, in this study, the subjects were told to eat all they wanted, but to eat only foods from their featured diet. So for the Mediterranean style of eating, they were allowed all the fruits and vegetables they wanted, all the fish and lean meats they wanted, salads with raw, brightly colored vegetables, and copious olive oil. When bread or pasta is eaten, it is made from whole grains. Dairy is consumed primarily in the form of soft white cheeses and fermented dairy such as yogurt. And understand that sweet desserts and sugar-sweetened drinks are a rare treat. Now, in all fairness, the study also found the Mediterranean style of eating with nuts and seeds provided true benefits, but the olive oil group experienced slightly more. The best way, of course, is to add nuts and seeds to the olive oil-rich diet. And remember, no one counted calories. And if they remained hungry, they're allowed to eat more. They just had to choose from the healthy foods allowed, including more fatty or oily foods. Our first story today told of how eating healthy in our middle age leads to better mobility in our senior years. And this study provides even more details on the types of foods we should be eating to make mobility and overall health the best possible. When it comes to diet, the Mediterranean style is clearly the healthiest. Well, today on Your Health, we'll discuss the health benefits of supplementing extra magnesium. Stay tuned to learn more. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Welcome back, everyone. It is great to be with you today. This is just a wonderful health education month, isn't it? We're learning so much. Every fall when we have our fall savings celebration at Bioinnovations, we do this health education month where every day we have fantastic topics. Today's going to be no exception. We're going to be talking about magnesium, this amazing, amazing mineral magnesium. I tell you, it is involved in over 300 crucial pathways, metabolic systems in the body. This is fantastic. So when you get your levels up, that's why we call it today maximum magnesium. You get that level up to where it should be, good health is going to follow. Right. It's kind of like one of those, Richard, it's one of those unknowns where really when you start taking or supplementing with magnesium, you don't really feel it per se. All of a sudden you start feeling good. Oh, wow. And you notice, oh, those aches and pains are a little less. And maybe you didn't get sick like you used to.
Right. You know, everyone thinks about calcium. And there's been a lot of research on calcium, and it is essential. But the driving force behind calcium is primarily the milk industry. And milk is a good source of calcium, and we need calcium. But magnesium is just as important, but there's no commercial enterprise pushing it on us. And so we need to pay a little more attention to magnesium, and it could be the cause of your declining health. Magnesium is the 8th most abundant element on the Earth's crust. It's the 4th most abundant element in the human body. A typical human has about 25 grams of magnesium in their body. It is essential for more than 350 different enzymatic reactions, controlling some 1,000 or more chemical reactions throughout the body. We have our enzymes that control the chemical factory that is known as our physiology, and some 1,000 different chemical reactions are dependent on magnesium. Examples of what magnesium does for us: it maintains muscle and nerve function. It keeps the heart in a steady rate and rhythm. It supports the immune system, keeps the bone strong. It's actually more important for bone strength than calcium intake. Most important mineral for electrolyte balance. Are you having trouble keeping your potassium level up, or perhaps your calcium is going a little too high for you? Doctors give you more potassium, but it still stays low. They do things to lower your calcium level. Well, the problem may be you don't have enough magnesium, because doctors typically don't check magnesium. They're getting better about it than in the past. But if your magnesium is low, you will have a hard time controlling potassium. You'll have a hard time controlling calcium. It controls all of those through proper magnesium levels. It controls your cellular clock. This is new information on magnesium. Having a hard time falling asleep at night. This is part of our circadian rhythm. Our body has a cellular mechanism that is a timepiece. It helps us to know when it's time to go to sleep, time to eat, time to rest, go to work, all this. You know, you get into a rhythm. This stuff just comes natural. You don't have to think about it. But when magnesium level is low, it affects our body's internal clock. And insomnia is a classic feature of that. People take sleeping pills to help them sleep, and they do help you go to sleep, but the real problem may be low magnesium. Our circadian rhythm, our body clock, is run by magnesium. Isn't that amazing? Secretion and function of insulin requires magnesium. ATP, our body's energy molecule, cannot be formed without magnesium. The association of the phosphate to the nucleoside does not occur without magnesium in its presence. So your cells don't have any energy without magnesium. Magnesium activates the B vitamins, assists in clotting and the preventing of unnecessary clotting, activates vitamins including vitamin C. Dietary magnesium is absorbed in the small intestines. It's excreted through the kidneys primarily, but a little bit from the skin and from the feces. The kidneys regulate our body's bloodstream magnesium level, and scientists have not figured out yet what hormone controls magnesium level. It is my suspicion it's pregnenolone, but I don't have proof of that yet, and I challenge you scientists to determine. Let's figure out the hormone, because I think many people who have chronically low magnesium levels have a hormone problem that is yet to be discovered. We can help a lot of people with this, as you'll see as we talk about the benefits of supplementing magnesium. To understand magnesium, you need to understand these points that follow. 60% of our magnesium is found in the bone. 60%, 39% is found inside the cells of the human body, inside the tissues, and 1% is found in the bloodstream. The maintenance of normal magnesium blood levels is the highest priority. So if our intake of magnesium is low, in order to maintain a proper blood level of magnesium, we will slowly leach out magnesium from our bones, leading to osteoporosis, and from our cells, leading to all these cellular aberrations. We call it disease. So this also helps you to understand that oftentimes a blood level of magnesium is unreliable because the blood's level of magnesium is the top priority. We take it from our bone, we take it from cells so that the blood can have a normal level. Now, usually the blood magnesium level is okay to test and it is reliable, but not always. As we go through these things, this discussion on magnesium today, you may say to yourself, you know, my history is so much like a low magnesium level, but when the doctor checks the blood, it's normal. You may have to do a magnesium challenge or a magnesium level in the red blood cells to see if you are truly low in magnesium. Most of the time, a blood level is sufficient. Now, let's do our magnesium quiz. You want to find out if you have a magnesium deficiency? Here's the first place to look. Let's take a quiz. As we go through this, give yourself a point for each question that you answer positively. Do you drink alcohol daily, or have you had alcohol daily in the past for a prolonged period of time? If so, it's 1 point. Do you engage in extreme exercise, endurance, exercise, work in hot climates, sweat a lot in your profession? If this is a regular occurrence for you, give yourself a point. Are you plagued by insomnia, emotional challenges, depression, stress, anxiety, anger, irritable, confusion, memory or concentration impairment, hyperactivity, or even apathy? Give yourself a point or two, depending on how many of these you have. Cardiovascular disease of any type. Are you hypertensive? Do you have an irregular heartbeat, an arrhythmia? That's a point. Asthma, shortness of breath, chronic bronchitis, or COPD. Highly likely you may have a magnesium problem there. Low calcium or potassium levels. Give yourself a point. Do you have irritable bowel syndrome or inflammatory bowel disease? You lose magnesium with these conditions. Constipation or diarrhea. Chronic diarrhea leads to low magnesium. Have you had major trauma, surgery, or closed head injury? Control of magnesium is compromised with head injuries. Closed head injuries, not a little bump on the head. If you've been in a coma due to a car accident, yes, absolutely, give yourself a point. More than 3 servings of caffeinated beverages or any form of caffeine daily for prolonged periods of time, it tends to wash out the magnesium. Chronic pain, chronic fatigue, fibromyalgia, migraines, frequent headaches. Cold extremities, muscle cramps, spasms, twitch, ruptured disc, carpal tunnel syndrome, Raynaud's or restless leg syndrome. These are all common signs and symptoms of low magnesium. Are you a diabetic? Type 1 or 2, either one, or gestational diabetes or a pre-diabetic? Do you rarely eat raw fruits or vegetables, or eat a lot of sugar or fast food items? Do you have trouble swallowing your food? Get caught. Does it get caught right here? Have you had polycystic ovarian disease, trouble with fertility, PMS, or painful periods? Any of those would give you a point. Kidney stones. Do you take a diuretic, an antibiotic, steroids, oral contraceptives, hormone replacement therapy, or seizure medication for any reason, including control of chronic pain? And one of the newer ones that's emerging, proton pump inhibitors for heartburn, a major cause of low magnesium levels now. So many people take these medicines. Mercury amalgams, dental fillings. Give yourself a point. Osteoporosis, classic sign of low magnesium. Hyperactive parathyroid or thyroid gland. Hyperparathyroidism, hyperthyroidism, either one can wash out magnesium. Have you been through cancer, chemotherapy, radiation for cancer? Are you a smoker? Have you had a stroke or a TIA, a liver or kidney transplant? Let's go to our break. Add up your score. When we return, we'll interpret the results. It'll give you a good idea whether you need to add more magnesium to your plan. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. We're back, everyone. If you're just joining us, we're talking about the amazing mineral magnesium and how important this one is for good health. Before the break, we took a quiz that was rather lengthy, but still it was important, and I'm sure that you've all kept along and added your score. So, Richard, that was 1 point for each item that we answered yes to.
That's right.
So let's interpret now.
Well, if you only have 0 to 2, you're doing really quite well. And if you're in that category, keep engaging in your plan of prevention, your healthy diet, and your daily multiple vitamin and mineral, which should contain magnesium. You still need to have daily magnesium, but you're not in trouble. You don't need to take larger amounts in general. If you have 3 to 4 points, you're on the edge. Start eating healthy. Supplement magnesium around 500 milligrams a day. And the chelated versions are the best as opposed to magnesium oxide or some of these other less absorbable forms. If you have 5 to 8 points, you're struggling. And I assure you, I understand that you're not feeling well. 5 to 8 points. You've had some tough breaks in life, some medical history that has really knocked you down. You need help, and magnesium supplementation is absolutely part of the answer. Use both the topical magnesium and the oral magnesium while improving your diet and lifestyle practices. If you have 9 or more points, you need to see a doctor who is experienced in magnesium management. You may need a magnesium challenge test. Maybe the blood level would be enough. If it's low, if the blood level's low, that's all further you need to go. It confirms that we're in trouble with our magnesium. Sometimes it can get so low, this magnesium level, that the oral route doesn't absorb very well. Then we have to rely on skin application or injections, IV or IM of magnesium. This is fairly common. This is new material on cancer patients. Certain types of chemotherapy really depletes magnesium, and it goes so low that the oral route of administration isn't enough. You have to have it IV. You can get that low. So if that happens to you, don't be surprised. It's okay. We've been giving IV and IM magnesium for well over 120 years with good results all around the world. We have a lot of experience with it. Now let's get into our research on magnesium. We have quite a bit here. Let's just go into it and see what we can see as time allows. Dennis Goodman, who is one of the world's leading cardiologists, wrote in his book, Magnificent Magnesium. Magnesium is the conductor of our body's biological symphony, orchestrating the proper function of approximately 80% of your body's metabolic processes. 80%. I think of magnesium as the ion that creates the body cell, the energy of the body cell. It's like a little battery. The cell is like a little battery, but without magnesium, the battery has no charge and the lights go out. It's that essential to life. Magnesium controls the cellular clock. We mentioned about that. The metabolic rate and the type of metabolism you have, the metabolic clock. As magnesium levels drop, this is a result of a study, total body inflammation increases. The C-reactive protein increases, tumor necrosis factor, nuclear factor kappa beta. They've found out the indicators of inflammation in the body. They've researched it enough. Multiple population studies show as magnesium content of water decreases, as the soil content of magnesium decreases, we typically do not ingest enough magnesium. Each successive generation with modern farming techniques is ingesting lower levels of magnesium in their food. It is estimated that the food eaten today has 50% of the magnesium it did 100 years ago. That's a hard thing to prove, but there is considerable evidence that suggests that. Anywhere from 32 to 80% of all Americans, depending on where you live in the country and your diet, 32 to 80% do not ingest enough magnesium in their diet. 2.5 to 15% of the general population has low magnesium levels in their bloodstream. If you are a hospitalized patient, the likelihood goes very high. One study analyzed 1,033 successive admissions into the hospital. Just as they come in, right in their order, 54% of them had low magnesium levels. If you're low in magnesium, you're a regular at the emergency room. That's the point I'm trying to make. Been in the hospital 2 or 3 times in the last few years? Very likely you're low, 50-50, that you're low in magnesium. You need it anyway every day. You may need extra. Dietary intake is a half of what it was in 1900. Agricultural practices, fertilization techniques, food preparations, processing foods eliminates the magnesium, lowers it dramatically. Magnesium supports a healthy heart. Low magnesium leads to heart disease. Here's one of the best examples we have in epidemiology of magnesium's effect on the heart. Northern Finland has some of the highest cardiovascular disease rates in the world. They have low magnesium levels in their groundwater. Southern Finland has some of the lowest rates of heart disease in the world. They have high magnesium content in their water. We could stop right there, and I think you'd get the idea. If we have low magnesium in our groundwater, because that is a leading source of our dietary magnesium, it leads to big trouble, cardiovascular disease. Swedish research has found those with high magnesium content water, 19% lower risk of death from heart attack, 80% lower risk of coronary artery lesions. 80% lower risk. If you have hard water, you have a high magnesium content water. But what do we do with hard water? We soften it. That takes the magnesium and iron out and replaces it with sodium and other calcium and other electrolytes. It tastes better, but it's not so good for you. That's the problem. And you know, hard water does taste bad. Have you ever had high iron content water?
I have.
I'd be chronically dehydrated if I had. I understand that. So if you're in that scenario where you're softening the water just so you can use it in the home, I get that. Get your magnesium from another way, but please do. Your body is screaming for magnesium. Let's see, Swedish researchers say, yes, lower risk of coronary artery disease, coronary lesions, lower risk of heart attack, death if you have good magnesium. A study wanted to find out why that happens. Here's what they found in an animal study. Low magnesium water is linked to decreased HDL, decreased glutathione, one of your master antioxidants, decreased phosphatidylcholine, a transmitter that helps to control the heart, cell membrane strength in a dose-dependent manner. Magnesium is critical for immunity and detoxification. They explained why low magnesium leads to heart disease. New study from Japan, as magnesium decreases, we have an increasing risk of hemorrhagic stroke, death from stroke in men, and death from ischemic stroke, coronary artery disease, heart failure, and total cardiovascular disease in women. Magnesium alleviates the symptoms of mitral valve prolapse. You know that little irritation you get, the little flutter in your heart? Magnesium and CoQ10 can make that go away almost completely for most people. We have more research. Stay with us. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart, and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, Bioinnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings.
We're back, everyone. I've got a little announcement. It is Fall Savings Celebration at BioInnovations, and what a celebration we're having. Fantastic prices and free shipping on orders over $50. Of course, that's the mail in USA. But get your order in to get the supplements you need so you can have a healthy fall, healthy holidays coming in a few months. Great time to get healthy. And this talk on magnesium makes me want to make sure that I check mine, and I'm right there with you.
Yeah.
So, Richard, the research is amazing.
Yes.
We always find when you listen to these stories a common thread, and then you always will hear, oh, that was me.
Right.
Or even in your past history, maybe not today.
Right.
So you still want to take notice of that.
So that's our role here, is to be your personal researcher and help you understand why the health is not responding. This is very important. Now, we were talking about how magnesium helps to reduce cardiac arrhythmias, these irregular heartbeats. And the mitral valve prolapse is a classic thing. You know, the mitral valve, meaning mitral is two-sided, like the cardinal's hat. You know, it's a two-sided valve. And normally it beats like this, it goes like this. But with prolapse, it flops back. And that's very irritating to the heart. It leads to irregular beats. And a study of 200 people with arrhythmias, they saw a significant drop in these arrhythmias, especially mitral valve prolapse, but others, when they simply added magnesium to their protocol. PVCs, classic sign, premature ventricular contractions, classic sign of low magnesium. The life-threatening critical arrhythmias is torsade de pointe, twist of a point. Doctors and nurses, you know what that is. Also, a long QT syndrome. These are your classic low magnesium signs with heart rhythms, heart arrhythmias. Please pay attention. These are life-threatening things due to low magnesium level. Magnesium intake, as it increases, lowers angina. Less heart pain with magnesium. Helps dissolve blood clots that are unnecessary. You know, you want your blood to clot when you cut yourself, but you don't want it to clot up and cause a mess when you simply bruise something. Well, magnesium helps to keep that process in check, dissolving clots that we don't need. High magnesium level associated with 37% lower risk of sudden cardiac death. The American Journal of Clinical Nutrition, highly respected. 40% reduced risk of sudden cardiac death. And folks, remember, every other person dies of heart disease. Sudden cardiac death is common. 40% lower risk. Controls blood pressure. A study of 60 men and women with high blood pressure. Magnesium lowers both systolic and diastolic pressure. It doesn't lower it in people with normal blood pressure. So don't worry that you become hypotensive if you have normal blood pressure. It doesn't do that. It knows the difference. Somehow it knows. Somehow it knows. Relaxes muscles that control blood vessels, allowing blood to flow more freely. It's a natural calcium channel blocker. We have a whole list of medicines used, calcium channel blockers, to treat hypertension. Magnesium does the same thing. And it's been my experience, if you respond really well to a calcium channel blocker, it's a sign you're low in magnesium. Maybe the magnesium alone will control your blood pressure. I can't promise that, but there's a very good possibility. Magnesium with vitamin D probably will. Over time. It takes time to correct these things. Helps to equalize the level of potassium and sodium in the blood, salt-sensitive hypertension. So many people, hypertensive, they're on diuretics. And that's a very cheap, effective way to keep your blood pressure down. But it depletes your potassium. When your potassium is low and it won't respond, it also depletes the magnesium. That's the thing the doctors and nurses forget. Everyone's attuned to the potassium problem, but they forget all about the magnesium. So if you're in that scenario, is you take the potassium, but it doesn't respond, it doesn't come up. That's because your magnesium is low and it controls it all. So if you have low potassium level, think low magnesium. Supplement them both. A high normal potassium is a life-saving state of health. You want good potassium levels. A lot of good comes from that. Magnesium supports diabetes. 82% of all diabetics are low in magnesium. It's a major reason why they became diabetics, and that has been clearly established now. Magnesium supplementation in the diabetic improves insulin levels and glucose levels. You'll be able to manage your diabetes better with normal magnesium levels. This requires supplementation. It improves endothelial dysfunction in diabetics. It improves insulin resistance. It'll improve your glucose level, your fasting blood glucose, your postprandial glucose, and your long-term glucose all improve a little. You know, you add your probiotics to that, your alpha lipoic acid, and change the diet. And so many of you won't need the medicines then. It requires a complete holistic approach, but it is absolutely possible, absolutely possible. Not everyone can get off the medicines, but we do what we got to do to control this diabetes. And see, here's the point. No drug can do what magnesium has been assigned to do. And we keep throwing drugs at things that are due to, problems that are due to nutrient deficiencies. It's one of the major shortcomings of American medicine. I don't want that to happen to you. That is the point of all this. No drug can do what magnesium does. Don't fall into that. Take your minerals. You got to have them. What else? Growing evidence that inflammation is induced by low magnesium levels. And low magnesium inflammation, what's it lead to? Cancer, heart disease, degenerative arthritis, things that really cause disability, pain, and suffering. Magnesium deficiency leads to everything hurts more when you're low in magnesium. When the magnesium level comes up, everything calms. You can relax, you can fall asleep. You know that sense when we're just ready to fall asleep, oh, everything's fine in the world, off you go. You're not getting that properly when you're low in magnesium. Magnesium modulates glutamate receptors, the #1 neurotransmitter in the brain. You know, we can't make serotonin without the presence of magnesium. All of this is dependent on magnesium. Proper brain state. High levels protect the brain from trauma. If you were in an accident and go into a coma, if your magnesium level is good and high and normal when you go into that coma, you're more likely to come out of that coma. It's protective from head trauma. Isn't that amazing? We have more, and your condition may be coming up next, so stay with us. We have a little more after the break. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
Talking about the sunshine vitamin, vitamin D3, makes me think of other ways to bring a little sunshine into our lives. The often quoted columnist of Pertinent Proverbs, William Arthur Ward, once wrote, "A cloudy day is no match for a sunny disposition." This echoes what Solomon said in Proverbs 15:30. A cheerful look brings joy to the heart, and good news gives health to the bones. Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back. Just a quick reminder, it's fall savings celebration at BioInnovations. Fantastic prices and free shipping on your orders over $50. Of course, that's the mainland USA. Don't want you to miss that one. So, Richard, this is just amazing.
Yes.
You actually have a study that magnesium can alleviate osteoporosis.
It can. For every 100 milligrams of magnesium you add to your supplement plan, you can increase your bone mineral density by 1%. So 500 milligrams of magnesium, that's a 5% improvement. That's better than the leading osteoporosis drug. And this is additive over time. You know, we can add another 5% as we continue a healthy plan with magnesium. Also, the pain and muscle soreness of fibromyalgia. After 2 months of taking magnesium, it is significantly reduced. To the magnesium for fibromyalgia, add vitamin D and curcumin. Physical activity, and we're going to start making progress. There's a whole list of things you can do for fibromyalgia, but magnesium, vitamin D, and curcumin is at its core. What about ophthalmic diseases? There's increasing evidence now that magnesium deficiency is associated with cataracts, glaucoma, and diabetic retinopathy. Magnesium deficiency is not the sole cause, but it's playing a role. Remember, we said magnesium deficiency leads to body inflammation that is not normal. And of course, free radical damage and body inflammation, they are associated with cataracts, glaucoma, and diabetic retinopathy. Next, urinary urge incontinence. You get the urge, this is especially common in women postmenopausal who have had babies. They get the urge to go to the restroom and they leak. Urge incontinence. Did you know taking 350 milligrams of magnesium on a daily basis gives you significantly fewer episodes of urge incontinence? You will urinate less frequent awakenings at night to get up and go. That leads to better sleep, better restoration, everything. Urge incontinence relieves constipation. Low magnesium is a major cause of chronic constipation. Minimizes the severity of asthma attacks. We know IV magnesium, IM magnesium, oral magnesium, topical magnesium, all lessen asthma symptoms. And it can be used in an emergency setting. While you're driving your child to the emergency room, rub some magnesium on the chest as you're going if it's status asthmaticus, you know, the life-threatening form of asthma that if you don't do something, that child's going to die. While you're headed in, get some magnesium on the skin. This stuff makes a difference. It truly does. Doctors have been given IV magnesium for asthma for over 100 years. It works. A lot of research to support it as well. Attention deficit hyperactivity disorder. Remember, the neurotransmitters need magnesium in order for them to be properly produced in the brain. And mood, attention, all of this, hyperactivity is all neurotransmitter based. Magnesium helps these kids. It does, it really does. Emotional irritability, chronic depression and anxiety. Magnesium and vitamin B6 are required to make serotonin. And they help the brain to be in a relaxed, accepting state. Magnesium. If you're struggling with depression, please take a little extra magnesium in your B vitamins. Taking magnesium along with calcium lessens the overreaction to stress. Now, you're supposed to feel a little stress. It tells you to back off. But we may overreact to stress and become incapacitated from stress. This is a sign your minerals are off. Get on the magnesium and calcium together with your B vitamins. Do the holistic approach, and you're going to be able to endure that stress much better. Supports hearing. A study found that laboratory animals fed magnesium suffered less hearing loss when exposed to loud noises. You know, when we're young, we don't realize that the loud music is damaging our ears. We don't realize it while we're driving the tractor on the farm, the heavy equipment on the construction site, the impact hammer. You construction guys, you know what the saws, it's all damaging your hearing. And if allowed to go too far, you'll never get it back, and you will be the guy who says, huh, all the time. Don't be that guy. Protect your hearing with hearing protection. You know what to do, earplugs and muffs, this type of thing. Recreational shooters, target shooters. Gun sounds rapport are very damaging to the ears. Well, they were able to prove in this series of studies that magnesium helps to prevent the hearing loss associated with loud noises. And they even found it can correct some of the hearing loss associated with loud noises. This is a big deal, very helpful. Losing your hearing is disabling. It really, truly is. And the most common reason to lose it is loud noises over time. And it's happening when we're young and don't realize it's happening. By the time we get to be 50, 60, 70, damage done. Prevent that. Do your best. Take care of your ears. It's very important. Migraine sufferers. 60% of migraine sufferers respond to supplemental magnesium. Also, check the triggers. Almost 90% of all migraines are triggered by certain things that you're doing. Diet, circumstances, stress, certain foods. But magnesium will help calm down these migraines. PMS, 90% or more of people with PMS, ladies, it gets better with magnesium, B6, probiotics, certain things you can do. But magnesium helps to normalize hormonal production, and it reduces the cramp, the spasm. That, oh, that's so painful for you. I understand that. Magnesium over time. You know, so many times when the young lady is suffering, well, I'll take a little magnesium now. Well, that may help a little, but what works best is a plan. 2-3 months in a row of this, you're going to notice with vitamin D, magnesium, and curcumin again. Here you go. There's that trio comes up over and over again. Endometriosis, polycystic ovarian syndrome, PMS, severe pain. You know, young ladies, they miss school, they miss work from this. And get on a plan, it will help you. Not everybody has to go on birth control pills to control their periods. Nutrients can help too. 41% fewer hot flashes in breast cancer patients because we counter the hormones in breast cancer. Magnesium helps to lower those hot flashes. Restless leg syndrome. Let's talk about this just for a second here before we go to our break. You're falling off to sleep and you have to move your legs, and of course that wakes you up. The majority have restless leg syndrome due to a magnesium deficiency. Get on the magnesium, rub the gel on your legs and your low back, take it orally, give it a little time. That restless leg is going to be a thing of the past. The medications approved for restless leg can make your condition worse. Yes, they do help as long as you're taking the drug, but 18 months later, you're worse off than when you started. I don't like that. Use magnesium. It almost always works. Almost always. All right, let's go to our break. We'll have a wrap-up of what foods have magnesium and how much to take in the supplemental form. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. The next time you're buying meat, look for low-fat, uncured, unprocessed meat in its natural state. Why? A low-fat, natural meat diet could be the healthiest of all. Research from Harvard University compared processed meat diets with natural meat diets. The extensive study involved more than 1 million people in 10 countries. The scientists discovered a diet of processed meat that contains preservatives and nitrate-curing agents, such as bacon, sausage, and deli meats, increased the risk of heart disease by 42% and diabetes by 19%. They also found natural meats, free of these curing and preserving agents, did not raise the risk of heart disease or diabetes at all. So shop for lean, uncured meats free of additives and in their natural state. For your health at a glance, I'm Cindy Becker.
You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by Bioinnovations, trusted products for your health and well-being. We're back, everyone. Just a very quick reminder, it is fall savings celebration at Bioinnovations. Fantastic prices and free shipping on orders over $50 in the mainland USA, so don't miss it. So, Richard, magnesium, yes. How do we get it in our diet?
Well, first is our groundwater. Hard water has the most. As you go west in the North American continent, the groundwater magnesium level drops. Okay. Next, all vegetables, but especially green leafy vegetables, because of the chlorophyll. Magnesium is the center of the chlorophyll, that green molecule that makes plants green. So all green leafy things have magnesium. Fruits, all fruits, molasses, honey, maple syrup, refined sugar, none. But the naturally occurring, or more naturally occurring, like molasses, honey, and maple syrup, it has significant magnesium in it. Whole grains and bran. White flour has little, whole grain has significant. Nuts and seeds are the single best source of dietary magnesium. Nuts and seeds. And it is a major reason why a handful of nuts a day lowers your risk of cardiovascular disease by 60%. Isn't that amazing? A handful of a variety of nuts and seeds. Next, beans of all types, very good in magnesium. Milk and eggs, good magnesium. Fish and tuna, refined, processed, and fast foods have very little magnesium. And understand, even healthy foods that are unprocessed, each generation magnesium levels are dropping because farmers don't put it back into the fertilization process. We need 320 milligrams a day for women of magnesium, 420 milligrams a day for men. Experts say that may be too low, especially if you're on a medicine like a diuretic that washes out the magnesium. You're going to need more than that. Topical magnesium gel, magnesium chloride is the source, which is the same as what seawater would have in it, is a reliable way to raise your magnesium level. It's been proven. Magnesium chelate, the reason we do a chelate with various amino acids, it's the cheapest way to get you a high-quality magnesium oral supplement, magnesium chelate with amino acids. It is gentle, it slowly releases so it doesn't create a state of diarrhea. 250 per capsule. If you're in trouble with magnesium, you can take up to 1,000, 4 of them every day without any diarrhea. Too much magnesium leads to loose stool. When you're loose stool, you deplete magnesium even more, so don't do that. So for most people, 2, 3, or 4 capsules of magnesium chelate a day is a good way to go. It'll bring it up. And then you add a little magnesium topical gel. Boy, that stuff is wonderful. Sore muscles, I put a little on my neck, you know, before I go to sleep at night, helps me fall off to sleep. It's really wonderful, and I want you to experience the benefit as well. Thank you for your kind attention. We'll see you tomorrow, folks.
Thanks, everyone. Bye-bye.
I'll never forget the time I met Dr. Stanley. I told him my idea to plant a church for broken and hurting people, but that I was afraid. He said, "Brian, don't you know God will take responsibility for all of the consequences of a heart that's fully devoted to Him?
Join Jim, Lori, and the Baker family every day for prophetic updates,
These are revelation days.
inspirational ministry,
We need to stay alert. We don't live in fear. We live in faith.
and powerful teachings from charismatic ministers, prophets, and influential figures from around the globe. You won't want to miss the next episode